Ready?
Yeah.
Okay. Hello, I want to thank everybody for joining us this afternoon. My name is Judy Shaw, and I'm the Chief of the Appeals Unit for the Maine Paid Family Medical Leave Program. I'll be moderating and leading this afternoon's webinar regarding private plans. Before I go further, I just want to note that today's webinar will be recorded and will be posted on the department's webpage under the Paid Family and Medical Leave. Today we are here to provide you with some important information regarding private plans, specifically the difference between a fully insured and a self-insured private plan, and how to apply for a substitution beginning April 1st, 2025. The applications will be through the Maine Paid Leave portal. After the overview, we will be answering your questions. If you do have a question as you're listening to the overview, please put your question in the chat. I have some great people here assisting me today who will keep track of those questions, and I'll answer as many questions during the session as I can. So with that being said, I'm going to share my screen. So sharing's not turned on. One second, please. There we go.
Hold on one second. We just want to make sure we get the black thing out of folks' way.
So our goal today is to provide you with the information that you might need to decide whether to provide benefits through your own private plan and the steps you would need to take to apply for and implement your plan once it's approved. In addition to this webinar, I just want to encourage you to please check out our website, maine.gov/paid leave, for additional information and resources on private plans. There we go. It's important to remember that all employers who have at least one employee earning wages in Maine have certain obligations. So first, they must register through the Maine Paid Leave portal. Information about and the link for the portal can be found on our website. Additionally, beginning with pay dates on or after January 1, 2025, employers started withholdings for PFML premium contributions based on the contribution rate applicable to that employer. The first quarterly contribution reports and the first quarterly premium payments will be due no later than April 30th. My first note for you is if you are an employer and have not registered in the portal yet, would you please do so as soon as possible? But you might be thinking, what if I don't want to provide benefits for my employees through the state plan? Can I opt out? And the answer is sort of. The key to remember is that the plan you provide must be substantially equivalent to the state plan, and the approval of a private plan substitution does not mean that you opted out of the PFML program altogether. It just means the employer with an approved plan would be exempt from paying premium contributions to the state PFML fund, but the employer still must register in the portal and file wage and annual reports. So let's take a look at this a little more closely. What does and does not qualify as a private plan? Well, first of all, as I mentioned, private plans are employer plans that provide benefits and contain terms that are substantially equivalent to the state PFML plan. Some of the things that do not qualify are plans that only cover an individual's own serious health condition, like short-term or long-term disability policies. Those wouldn't qualify because it wouldn't cover things like if I needed to take time off to care for a seriously ill family member. Plans that can be changed at the employer's discretion Remember that if any private plan is approved, any material changes to that plan can only be made with prior approval from the department. And plans that consist solely of leave benefits that need to accrue, like PTO, vacation, or sick time, those would not qualify for a private plan substitution. There are two types of private plans that employers can apply for: fully insured plans and self-insured plans. And as I mentioned, applications will be received beginning April 1st, 2025. So let's start by taking a look at the fully insured plans. If you're an employer who's interested in providing PFML benefits through a private plan, but you don't want or you don't have the infrastructure to develop plan documents and administer claims, you might decide to purchase a PFML insurance policy. Remember, as we saw in the prior slide, a short-term or long-term disability policy does not satisfy the requirements for a substantial equivalent plan and will not qualify as a Maine PFML policy. There are some steps that need to happen first. First, an insurer licensed to do business in Maine has to file their Maine PFML policy with the Bureau of Insurance. The Bureau of Insurance reviews the policy, and once it is approved, the Bureau notifies the department. We then review the policy and decide whether to certify it as an eligible substantially equivalent plan. If you purchase a PFML policy, it's important that the employer make sure it states that it is certified as an eligible substantially equivalent plan. 17 plans were filed with the Bureau of Insurance, approved by the Bureau of Insurance, and submitted to us for certification. All 17 insurance policies have been approved, and there's a list that appears on our website. So they have been approved and certified and are available to be used as part of a fully insured application package. Again, there is a list of these plans on our website. So once an employer has purchased an eligible policy, they can go ahead and apply beginning April 1 for a fully insured private plan substitution. When the employer goes through the application process, it's important to make sure that they have evidence of coverage nearby, because that information will be required as part of the application. The document, as you'll see shortly, will have to be uploaded into the portal. So all of this application process is done through the employer paid leave portal. So let's walk through that process a bit. As a reminder, if you have not already done so, the employer has to register in the portal. So make sure before you apply that you're properly registered in the portal. If an employer is registered in the portal, they would log into their account. And once they log in, they would see the summary page. If you're already registered in the portal, this may be something you're familiar with. The summary page has this summary header that says Summary, Action Center, Settings, and more. On this screenshot, we show that header for the summary page. To access the private plan panel, the employer would click on More. Once you click on More, various panels pop up below the summary header. So you'll see that when you're in the portal, if you scroll down a bit, you'll see on the right-hand side, Private Plans. This is the private plan panel, and the employer would click on the Request Substitution of a private plan. After clicking Request Substitution, the employer would be brought to an information page, which provides a great reminder of what you need to complete the application process. It also reminds the employer that if the application is approved, that only means the employer would be exempt from paying premiums into the Maine Paid Leave Fund, but they would still be required to file quarterly wage reports and the annual report showing the results of the private plan. For the fully insured plan, you can see you will need some basic information about the insurer and the policy, as well as evidence of coverage, which typically will be the first few pages of the insurance policy. You'll also see that there's a $250 application fee. After you review this information, you'll click a button that says Next. This will bring you to the attestation screen. These attestations give us assurance that important requirements are being met and will continue to be met as long as the private plan is in effect. So for example, the first attestation is attesting to the fact that an employee that takes family leave or medical leave under the private plan will still continue to accrue sick time, they'll receive bonuses, they'll maintain their seniority and other employment benefits. Also, that the employer will provide appropriate tax information, that the employer will provide any information requested by the department, and that the private plan substitution covers all employees associated with the employer's employer identification number. So the employer would carefully review each of these attestations and check the box next to each of them. Then they would click next. And please note that if you were to get interrupted as you're going through this application process, you can always save the draft and come back to it later. You'll see it at the bottom left, a button to save the draft. Next, the employer would be brought to a screen that asks the employer to select the type of private plan they want. For our purposes, we're currently talking about fully insured plans. So you would click the circle next to fully insured and then click next. This brings us to the fully insured private plan details. Here you will click the down arrow to see a list of insurance carriers with approved and certified plans, those 17 that I mentioned previously. You would select your carrier and plan number, and you would enter the benefit begin date. The benefit begin date is the date when your plan will begin to provide benefits to your employees. This date cannot be any later than May 1st, 2026. That's the date the state PFML fund will begin paying benefits. But an employer could choose to start providing benefits to employees before May 1st, 2026. As I mentioned, all 17 insurance plans have been approved and certified, and those plans are being added to the drop-down list. If your carrier doesn't appear in the drop-down list for some reason, you could click Other and manually enter information. But when we review your application, if the plan that you entered is not an eligible certified plan, your application will be denied. So be sure when you purchase an insurance plan that you are purchasing one that has already been approved and certified by the department. After entering information about the insurance carrier, the plan number, and the benefit start date, it's time to add your proof of coverage. The employer would do this by uploading at least the first few pages of the insurance policy that they purchased. Most insurance plans have summaries of coverage in the first few pages. The insurance document must contain, at a minimum, the type of coverage, the name and address of the insurance carrier, the policyholder's name, which would be the employer, the term of the policy coverage, so the effective date and the renewal date, and information showing the specific form number and approval by the Bureau of Insurance. Now, you don't have to worry about remembering all of this. If you go to our website, there's a detailed employer guide for fully insured plans, and this information is available in there. So when you know what document you want to add, you would click the Add Attachment button. I see one question that has come up that I think it would be helpful to answer, and that is, what is the plan number? Is it the form number that the state approved or my specific policy number that the carrier issues? If you look on our website for the list of approved and certified insurance plans, you will see that we list the insurance carrier name and the form number. And as these are built into the system, those plan numbers will already be built into the dropdown. If you don't see the plan number, what you want to add is that form number that is on our website and will also appear on your policy. But it is not your specific policy number, it's the policy form that has been approved and certified. So when you know what document you have that you want to add, you would click the attachment button. So we're going to be adding evidence of coverage. By clicking Add Attachment, you're going to be brought to this screen for you to select the file that you want to attach. So first you would click the down arrow to pick what type of file you will be attaching. For fully insured plans, we're going to choose private plan proof of purchase. And then you would click choose file. This allows you to search on your computer for the file that provides proof of purchase and evidence of coverage. And then when you find that file, you choose the file, you will click open, and the file will populate in the portal. You can see here that I chose my test document for ABCD private insurance plan policy. And so I have selected that and I would click OK. Now you can see that my document has been uploaded. For fully insured plans, no other documents are required to be uploaded. No other attachments are required. In the portal, there would be a next button. So you would click next to get to the next screen. The next screen allows you to review the basic application information that you have already submitted to make sure it is correct. You'll see that I put in a benefit begin date of July 1st, 2026, which is after May 1st, 2026. By reviewing this carefully, I would see that error and I would be able to go back to previous screens and correct the error. In practice, if I didn't see the error and clicked next, the system would return an error message, letting me know the date cannot be further out than May 1st, 2026. But I just wanted to use this opportunity to point out that the review is important because you can pick up that error and go back and fix it yourself. For now, we'll pretend that the date is correct. The next step would be to pay the application fee. Please note that the fee is $250, and if the application is approved, there will be an additional fee of $250 to support the cost of overseeing private plan substitutions, such as future audits of the implementation of the plan. Here you would click next and you'd be brought to the payment screen. On the payment screen, you would enter your payment method, or if you've already, you may have already entered a payment method when you registered in the portal. So you could either enter a payment method or select a method that you may have already set up when you registered in the portal. So you would enter the amount and then you would click next. The final step is to enter your login password and to submit the application. Please be sure to read the certification carefully. You want to make sure that you don't have any questions. You're certifying that you understand the information and that the information is complete and accurate. So you would click submit and you would be brought to the confirmation page. You want to make sure to read the next steps so you know what to expect. If approved, your obligation to pay premiums will stop the first date of the quarter when you applied, unless you submitted your application within the last 30 days of the quarter. In that case, your premium obligation stops on the first day of the next quarter. All communications with the program between the employer and us will be through the paid leave portal. And remember, if the application is approved, this only exempts the employer from the premium obligations, but not other reporting obligations. So what if my plan is approved? Some things to keep in mind. Please remember that until an application for a private plan is approved and you've received that notification, it is important to continue to comply with premium contribution and reporting obligations. If the application is approved, the employer is sent a notification through the paid leave portal. The notice will indicate when the exemption from premium obligations begins. It will indicate that the administrative fee is now due, and it will include the effective date and the date of approval and end date of the approval. Keep in mind that private plan approvals are good for 3 years from the effective date. They cannot be canceled before the end of the 3 years unless prior approval from the department is granted. It's also important to remember that prior approval from the department is required before any material change can be made to the plan. And for fully insured plans, the insurance policy has to stay in effect or your private plan may be revoked. As we've mentioned, the reporting and other obligations remain in place. You'll also get a notification through the paid leave portal if the application for a private plan is denied. The notice will give you the reason for the denial and it will indicate the right to appeal. But the employer's obligations do not change. There's still a need to withhold contributions, file wage reports, and pay premiums, even during a period of an appeal. Before we go on to self-insured plans, did you want to cover any questions or hold them? Okay, so now we're going to move on to self-insured plans. A self-insured plan essentially means the employer will implement a PFML plan that is substantially equivalent to the state's PFML program using the employer's own human and financial resources. This is an important decision and should be carefully considered. So here are some questions that we suggest an employer ask before deciding whether to head down this path. Does my business have the financial capacity to pay PFML claims made by my employees? Does my business have the financial resources, the human resources, and administrative infrastructure to oversee the full administration of a private PFML plan? If the infrastructure doesn't exist, does my business have the financial capacity to contract with a third-party claims administrator licensed by the Bureau of Insurance? And finally, is there any reason why my business would have difficulty obtaining the required surety bond? After answering all those questions, an employer believes a self-insured private plan is the best option for their business and their employees, they can apply starting April 1st through the paid leave portal as well. The application process is similar to the one for a fully insured plan, but different information is required. For a self-insured private plan, the employer will have to create their own plan document that is not unlike the insurance policies that get certified. In crafting the plan document, remember that the plan must be substantially equivalent to the state PFML plan. It will be important to track the law and the rule carefully because any substantial deviation could result in a denial of the request to have the plan certified as an eligible plan. The employer will also have to purchase a surety bond using the form required by the department. There are a couple of things to please keep in mind with the surety bond. One is that the surety bond must be signed by the surety company, not by your local insurance producer or broker. The amount of the bond is the equivalent of what the employer would otherwise pay to the state PFML fund over the most recent 4 quarters. So for example, if the employer's premium rate is 1% of wages and the total wages for the most recent 4 quarters is $500,000, the surety bond would be in the amount of $5,000. The bond form that has to be used, a checklist of what needs to be included in the plan document, and a template to use in creating the plan document, along with a guide, are all posted on our website under Employer Resources Private Plans. You can see that we start with the same process. Register if you haven't already, log in if you have, click on the More tab to get to the private plan panel, and click Request Substitution of a Private Plan. Read the information panel carefully to see what additional information you'll need, and click Next. Read and check the boxes next to the attestations, and then click Next. And here you would select self-insured for the plan type and click Next. This is where things change a little bit. This is where an employer indicates whether they will be implementing their plan using their own resources, meaning it's self-administered, or if they will be contracting with a third-party claims administrator licensed by the Bureau of Insurance. Let's say the employer is going to contract with an administrator, so they click No, they're not going to self-administer, and then they click Next. That brings us to this screen where they would enter the name of the plan administrator. So that's the third-party claims administrator, licensed by the Bureau of Insurance. This is not the same thing as a third-party payroll administrator you might have. This is actually an entity that specifically administers insurance-type claims. They would also indicate the name of the surety bond company who wrote their bond, and they would put in the bond amount. Once that information is entered, the next button would appear and the employer would click next. If an employer is not going to contract with an outside third-party claims administrator, then they would have clicked yes on the screen that asks whether the plan is self-administered. In that case, they would be brought to this panel, which only asks for information about the surety bond. I've entered some information, and now I would go ahead and click next. It's now time to attach some of the files that will come. These files comprise the documents to be reviewed as part of the application. And attaching the files is the same process as for fully insured plans, but the types of documents are different. So we would go ahead and select private plan documents and the private plan surety bond. These are the documents that need to be attached for this type of application. I decided not to show you how to add attachments again. Rather, I wanted to describe what these documents are. The first is the plan document itself. So the employer needs to develop a self-insured plan document that outlines all of the processes and procedures for administering the plan, for how employees will apply for benefits, for how benefits will be calculated, how any denials or partial denials of claims for benefits will be reconsidered, what that process will be, and any other aspects of the plan that establish that the plan is substantially equivalent to the state plan. As I mentioned, there's a template on our website that can be used, as well as a checklist that outlines what the requirements are. The checklist identifies what must be included under that plan document. And these resources are all on our website under Employer Resources, Private Plans. The checklist has a column where the employer will indicate the page in the plan document where the requirement is met. That checklist has to be completed and included as a cover sheet for the plan document that then gets added as an attachment in the portal. So you'll see that I've added a test document, PFML private plan document here. The other document that has to be added is the surety bond. And we've already discussed that, but that surety bond itself, signed by the surety company, again, not by your local insurance broker or producer, would need to get added as an attachment. Once both of those files are added, then the employer would click next. This brings us again to the review screen, and by clicking next, the employer will be brought to the payment screen. Once payment is confirmed, and again, you're making the payment for the application, the $250 payment. Once you've entered your payment method and the amount, you would click next. Again, the employer would review the certification statement carefully. They would enter their password and they would click submit to file their application. This brings us to the confirmation page with some helpful reminders, just like we had with the fully insured plan. And don't forget that the employer should continue to pay any premiums that are due until the effective date of the exemption, assuming that the application is approved. If the application is approved, the same notification process will be used and the plan will be effective for 3 years. Please remember that the application to use a private plan must be approved by the department and the private plan must be certified as eligible by the department. If the application is denied or the plan is denied certification of eligibility as a substantially equivalent plan, the employer would receive a notification through the portal. The notification would include the reason for the denial, and it would explain what rights the employer has to appeal the denial. There would be no change to the employer's obligation to pay premiums and file reports while an appeal is pending. So just a few final thoughts before we get to the questions. I know this has been a lot of information, so I would encourage you, if you haven't already done so, to sign up for notifications on our website. That way you'll get notified whenever additional private plan resources land on the website. So for example, notifications went out about the list on our website of approved and certified plans. Employers should check their accounts through the portal regularly because that's the way we will communicate with one another. Please keep any ongoing obligations in mind, including the fact that private plans might be audited, and if they are out of compliance or reporting obligations aren't met, the approval of your private plan could be revoked. And finally, please reach out to us if you have questions. Your first stop should be the website. It has a whole host of information under employer resources, including lots of information about private plans. But if you don't find the answer to your question there, you can either send a message through the portal or you could reach out by phone, and you'll see the phone number here, 207-621-5024. And so I'm going to stop sharing my screen and we'll answer some of the questions that have come up.
So,
Spotlight the owl.
all right, so we do have quite a few questions, so I guess I'll start with kind of the first one, and that is, do employers only register as one? I'm assuming that's one EIN.
Yeah, I'd have to see the original question, but so each employer has to register per their FEIN. I know there might be businesses with multiple FEINs that would need to register multiple times, or business owners that own multiple businesses with separate EINs. And the applications for substitutions also need to happen at the FEIN level. So if you have multiple businesses that you're looking to cover with the private plan substitution, you would apply for a private plan substitution for each individual FEIN. And if you make the choice that you only want to cover, some of your businesses with the private plan or some of your businesses with the public plan, you would apply for the substitutions of the businesses, the FEINs, that you want private plan substitutions with. So it would be by the FEIN that you register and that you would apply for a substitution for.
Okay. We did get quite a few questions about like the application fee. So the first one I'll read is that, is there any annual fee cost to remain on the state managed plan versus a private plan? So is there a fee to stay with the state?
No, the state plan is, the contributions to the state plans are the premium contributions. So that's the cost of administering the state plan, is the normal premiums that people will be making now, starting first quarter wage reporting. The private plan application and administration fee is unique to the private plan to cover the administration of those private plans by the state.
How much will the annual fee be?
So it's $250 application fee per application of a private plan substitution, and that's charged whether it's an approval or denial. If the plan is approved, there's an additional $250 for the entire 3-year substitution period. So it's not an annual $250. It's a one-time administration fee of an additional $250 for that 3-year substitution to cover, audit and appeals that originate from the private plans.
Okay. I think Judy hinted on, is the substitution of permanent approval, and no, it's 3 years. But what is the purpose of the $250 admin fee?
Yeah, it's to cover the state resources that are attributed to overseeing the private plans. Since employers who are no longer part of are paying contributions to the state plan, we still need to recoup by statute administrative costs of overseeing private plan application in the state. And the biggest costs of that are auditing, private plans to make sure that they are, operating as they should. And appeals that are generated, after the second, denial of a private plan, employees in the state have the right to appeal, to the state. So we have to spend time and resources in our appeals unit of considering private plan denials. And that is partially compensated by the $250 administration fee.
And just to clarify, so when it comes to the fee, is it based on whether it's approved or denied, or does that matter?
So the application fee, there's a $250 application fee that's charged regardless if it's approved or denied. If a plan is approved, there's an additional $250 for the administration fee for that 3 years.
Right.
Yeah.
This one's a little bit different, talking about payment methods, but what payment methods are available to submit the private plan fee?
Yeah, that's a great question. So it's ACH debit, ACH credit, or credit card through the portal. Checks are not allowed. I saw a couple of questions about checks, but it's, the payments are made directly through the portal, with ACH credit, ACH debit, or a credit card is accepted.
Okay, these cover the other two questions about payment methods. So kind of switching, do you have to have a certain number of employees in order to enroll in the public plan?
Well, the public plan applies to any employer with at least one Maine-based employee. I don't know if the question is, do you need to have a certain number of employees to have a private plan substitution? And the answer to that would be no.
Yeah, that's on public plan.
But yeah, the public plan applies to any employer that has at least one Maine-based employee should be contributing to the public plan.
Okay. Still kind of going versus private versus public, but is there any benefits to going through a private plan versus the state plan?
I mean, that's really a decision for the employer. I'm sure cost of both is a consideration, compliance or ease of compliance. But it really is a business decision that the law allows every employer in the state of Maine to decide based on their unique business needs.
Okay. So what happens to the money that's been paid until the fully insured plan is approved?
Yeah, so the first quarter payments for wage reporting are non-refundable because these are new insurance products. These are not plans that have been on the market previously. And applications for private plans, and this is an important point to clarify, applications for private plans are accepted on a rolling basis. So people also do not have to apply for a private plan in quarter two. It just begins quarter two and continues for forever, essentially, for as long as the program exists. So there has to be a natural stop date to when somebody enters, or stops their contributions if they apply for an application. So the private plan application process begins April 1st and continues, for the life of the program. So an employer can make a decision 2 years from now to go from the public plan into a private plan. And the exemption start date would be relative to when that substitution is approved. So the application process is beginning April 1st going forward, and all contributions made for quarter one in which the application process was not open must be made and are not refundable.
Okay. Just another kind of 30,000 quick question. So what happens if the state plan isn't solvent by day one? Will the private plans allow for a delay to coincide with the solvency?
So that's an excellent question. So our read of statute is that the potential 90-day delay of benefits in 2026 applies to the state plan because it's the solvency of the state plan that the authority is voting on whether or not the money is there for benefits to start May 1st or whether that needs to be delayed by 3 months. Private plans would continue as normal because employers have the option to either start a private plan immediately on approval of a substitution or approval of the exemption start date, or they can delay up to May 1st, 2026 to give them time, to update policies or whatever. But they have the option of starting to offer benefits now, once a private plan is approved, or delaying up to May 1st, 2026. But the May 1st date is set as May 1st. There's no delay for private plans because it is not reliant on the solvency of the state fund.
Okay. We got similar questions about where can I find the list online, and you can find them on the webpage on Paid Family Medical Leave under the Employer Resources tab. So that's where you can find the approved list of for carriers. So kind of like switching to the surety bond. So how is it calculated?
So it's calculated by taking the four most recent quarters, wages for the four most recent quarters, and then applying whatever the contribution rate would have been if you're making contributions to the state plan. So if you're an employer that has 15 or more, do I have that correct? 15 or more employees, then your contribution rate would be 1%. So you would apply that 1% against the total wages paid for the four most recent prior quarters.
Who's responsible for filing the quarterly report?
The employer is ultimately responsible for filing the quarterly wage reports, even during a substitution, whether they have a payroll administrator file on their behalf is their choice. But by statute, the employer is ultimately responsible for making sure wage reporting is happening, regardless of whether or not they're with the state plan or have an approved private plan substitution. If you have an approved private plan substitution and you're doing wage reporting, it's the same process. It's just that your premiums will generate zero. So you'll still submit your quarterly wages to build the wage data, but your premium amount will be zero. It'll be a zero bill essentially if you have a private plan approved. But the actual wage reporting process will be exactly the same.
Okay. These set of questions kind of get to what is the plan number, but this question is, can we add additional documents such as additional entity letters if we have subsidiaries that need to be included?
So each entity that's being covered by the private plan needs to be applied for by FEIN, and each entity needs to be applied for individually. So if you have subsidiaries, it all comes down to, are those within your one FEIN or do they have unique FEINs? If they're covered in your one FEIN, you have like an overarching FEIN for different levels of subunits. All those people need to be covered by your private plan that you're submitting for that overarching FEIN. If your subsidiaries are separate businesses and have their unique FEINs, those need to be applied for individually with the private plans, and the private plans need to cover the people within that FEIN.
Can the employer submit the entire policy instead of half pages in the portal?
Yes, they can.
Okay. I think you might have addressed this, Judy, but what is the plan number and is the form number that the state, let me read again. So is it the form number that the state approved or a specific policy number when it comes to the plan number?
Yes, if you look at the list of approved and certified plans, you'll see the name of the carrier, and then you'll see a form number underneath. So that form number is the plan number, as opposed to a policy number that's specific to the employer.
Okay. This question is, it's saying currently, I'm not going to name the organization, but it says currently this organization is not approved. Do you know if they will be approved in terms of the plan?
So I think I saw that question come through. So each employer has to have their unique private plan policy to submit. There's an open question of whether trusts can buy a private plan policy. Our statute is that the employer is responsible for buying their unique policy directly with the carrier and submitting that directly.
Kind of pivoting a little bit, but if you make updates to the approved plans, assuming the already fully insured plan, will there be a charge?
So you probably know the piece about substantial, if there's a substantial change, do you want to speak to that?
Yes, so first of all, updates to the plan, if there are material change, a substantive change, those changes cannot be made without prior approval from the department. So that's important to keep in mind. And then if there are material changes that are being made, and the department approves those material changes, then that's an amendment to the plan. The question about whether or not there's an additional application fee is one that I'm not sure.
Yeah, so if it's a substantial or it's what's the
Material change.
A material change, we just need to approve it beforehand. But I saw questions come through. What if I want to change like actual plans within the 3-year substitution period? Employers can do that, but it's essentially a new substitution. So if you're with, insurance company X, and you find 1 year in that you want to go to insurance company Y, You're switching plans, which we allow, but you need to apply for a new substitution within the portal. Pay the application fee and the administration fee again. And if approved, that starts the 3-year period over. So if you're making material changes to, your own plan, whether that's a self-insured plan, and an employer, I would imagine, is not making material changes to, a carrier plan. But if you're making a material plan to the same plan, you would ask for approval beforehand from DOL, who would, approve or deny, but there is no charge associated with that. If you're switching plans, it would be a new substitution that you would apply for. Yeah.
Switching it up to kind of the time frame in which we will review them. What is the estimate time to receive approval from the state?
So we're gonna work these as quick as we can, obviously, and point sufficient resources to them. We expect that fully insured private plan applications should be processed very quickly, because essentially we're just checking that, have you purchased a previously certified insurance plan? And then seeing the policy documents that support that, seeing the attestations, and, approving if it is a certified plan, denying if it's not a certified plan. So those are pretty straightforward. We imagine those will be processed very quickly, even if there's a large number of them. The self-insured plan applications are a bit of an unknown, because there might be back and forth with the employer based on the completeness of the application and the need for more information. So we expect that self-insured applications will take longer, and will really depend on the quality of the application themselves, with how thoroughly employers use the checklist to provide evidence of substantial equivalence. But we expect that fully insured products will be approved pretty quickly.
Okay. Just another benefits related question to private plans. Can private plans start before May 1, 2026?
Yes, the employer has the option by rule to start when the exemption starts, or to wait until May 1st, 2026 if they wish.
Okay. What other types of benefits does the employer need to maintain? All benefits that the employee currently was receiving at the time they took their leave? This is more of a general.
Yeah, and I think it depends how the question's framed. In terms of like what benefits overall, I mean, that's a decision for the employer, like how they want to adjust benefit packages around PFML. But if the question is like, you have your benefit package and somebody goes out on leave, they need to be maintained with the same benefits they would have as if they were working, is required by rule and statute. But in terms of what benefit packages, that the employer offers in terms of, short-term disability, long-term disability, PFML, PTO time, those are employer questions.
Okay, so also I saw some raised hands. If you could put your question into the chat, that would be great. We still have about maybe 40 minutes or so left. So we'll definitely get to all the questions as we can. But this next question is, can I stop contributing to the state plan once I receive the approved substitution?
So the exemption date it's a bit confusing, but it is in our FAQ. It's if you're applying within the first 60 days, essentially, of a quarter, it's the first date in which the quarter that the substitution is approved. And so if you apply April 1st, 2025, and we approved your substitution May 1st, 2025, the exemption goes back to April 1st, 2025. So you would still owe first quarter for wage reporting, just as everyone does. But the actual contribution stop date would be April 1st, 2025. So you would essentially have, no contributions due for the second quarter, 2025. If you apply in the last 30 days of a quarter, it's automatically the first day of the quarter after which it was applied for. So if you apply June 15th, 2025, and we approve it July 10th, 2025, the exemption goes back to July 1st, and you would owe second quarter 2025. But again, that's a bit confusing in the weeds, but it is specified in our frequently asked question documents on our website. And there will be, Judy can speak to this, there is a notice of like what your actual exemption date is from the portal, correct?
Yes, the notice, when you get the notice of approval, it will specifically say when your premium contribution timeframe ends.
And also, just to clarify, we do have until 1:30 for questions, so there's still time. This one talks about, again, multiple EINs. So if a large employer with multiple FEINs intends to apply for a private plan, can the same documents be used for all of the FEINs that will be covered under the plan?
You would need if it was a self-insured plan, you would need a different surety bond for each FEIN. The plan document could be largely the same, except it's going to identify different employers, because there's a different FEIN, so there would be some modifications to that plan document. And of course, the employer could decide for whatever reason that for one of their companies, they're going to start benefits before May 1st, and for another company, it will be starting May 1st. So it's really up to the employer to decide what makes sense. But if the plan is going to be the same for each of the different FEINs, then the plan documents could largely be the same, but it would require a separate surety bond for each FEIN.
So this question is, if you apply for a private plan, are you still permitted to hold the 0.5% from employees during the consideration period? And then this one within that is, are you permitted to withhold the 0.5% from employees from the time the application was approved until the beginning of the private plan start date? And if the answer is yes, what is guidance regarding how those funds are utilized?
So by rule, you can still do your withholdings, your deductions of payroll, until the private plan is approved. But if it's going backwards in time, and so using that example, where you apply for a private plan substitution on 4/1, let's say, and we approve it on May 1st, you can do your deductions up until May 1st. But you have to, since the exemption is going back to April 1st, and you as the employer will not be, filing those wage reports or filing that premium amount, those deductions that you withheld up until that period need to be returned to the employee if you're deducting from the employee, because that money is not being used towards anything at that point. It was deducted for the state plan, and you don't owe that money to the state at that point. So it needs to be returned to the employees by rule. If your exemption date is going forward, so again, using the example I used before, you applied, let's say June 15th, and we even approve you June 16th, but by rule, your exemption starts July 1st, right? You can still deduct up until that exemption date because you're still going to be contributing those premiums to the state. But that's in our FAQ too, because that's a bit confusing, and our rules.
Right. Okay, so if you approve for a private plan and run that for a year or more, can the employer return back to the public plan at any point and discontinue the private plan?
Judy, you want to answer that?
So that requires prior approval from the department if you want to terminate your private plan before the 3-year period. At the end of the 3-year period, you will get notification of the ability to renew the plan. But if you want to stop prior to the 3-year period, you'd have to notify the department, and the department would have to approve it in advance. If it's a self-insured plan with a surety bond, then you'll see from the bond form that the bond runs to the state. So the state may call the surety bond at that point because the plan is being terminated early.
And you want to review, because they can't just, there needs to be a significant business impact to return early to the state plan.
Yes, thank you for that reminder. Yes, the standard that the state is going to use in determining whether or not to approve a request to terminate the plan early is going to be whether or not there is a substantial and significant business hardship to the employer if they were to continue with the private plan. For the fully insured plans, it's really important to remember to pay your premiums, because if your policy is canceled for failure to pay premiums, or it's canceled or non-renewed for any reason, your private plan will be revoked.
So this question is getting the premiums. Is the premium rate set in stone for both plans, meaning both the private and public plan?
So private plan, it's up to the insurers to price. I think it depends on their pricing model. If they're, you know, advertising a year premium that might increase or decrease after that, or if they're offering a 3-year, that's really a private sector decision of how they want to price and market their plans. In terms of the state plan is set by statute at 1% until 2028, at which point it's going to be adjusted annually based on actuarial study of the solvency of the fund. So it could go upwards, it could go downwards. But the state plan is set at 1% until January 1st, 2028 at the earliest. But in terms of questions about the pricing of private plans, that's a private sector question. You know, that's up to the insurance carriers to, you know, price their plans. I do know that other state PFML programs, mature programs, generally operate, and this came up, you know, yesterday in the authority meeting. Other state PFML programs generally operate at a premium rate between 0.7 and 0.8. There are a couple states that are at 1%, but Maine, you know, with their actuarial study, opted to start it at a conservative rate of 1%. But most other states that are operating PFML programs are generally between 0.7 and 0.8, but it all depends on obviously our specific fund and the actuarial study of that, you know, in the next 2 or 3 years, what the rate might be in the future.
So we have about 30 minutes left. So this question is, if the employer stays with the state plan, what will be their responsibility once claims start to be submitted?
Yeah, so I mean, we'll be releasing a bunch of information about state plan claims, but there is a good amount of information now on our website. But essentially, you know, the state will be contracting with a third-party administrator to administer the state plan, and the employee will submit claims to that administrator directly. The employer will get notice of the claim from the administrator if one of their employees has applied, and they'll have the opportunity to provide information, including an undue hardship assertion if they choose to make one. The employer will be notified if their employee is approved for a claim or denied, but will be notified if their employee is approved for a PFML claim with the state, and if so, what the duration is, and what the benefit amount is, in case you want to top off their wages. That's kind of it in a nutshell. But there's a lot more information on our website about kind of that whole process.
Okay. Just going through, trying to see if I know, and we definitely appreciate the general questions too. We're just trying to make sure we hit all the private plan questions as well. So I guess the one question I kind of see going to general is, what happens if employees have more than one job? Do both employers contribute? And does the employee contribute to each of those jobs?
So each employer it's a question of state versus private, I think, too, but each employer is withholding the 0.5% from their employees. But you might have that same employee that's having that 0.5 withheld from multiple jobs, but it's up to the employer just to withhold and report to us, the state, across multiple jobs. We track employee wages by their social security number. You know, so if we have an employee with the same social security number that has wage reports from 3 separate employers, we'll pull that information to build their wage base. And our system will be tracking also by social security number, employees who might be in a private plan substitution as well. So we can calculate, when we're calculating the state benefit, off their state wage base and excluding the wages that are attributable to a private plan employment if they have multiple jobs and are both in and out of the state plan. We're going to be tracking that data in our wage base based on social security number of the employee. So the employer's responsibility is just to report the employees they have and not necessarily worry about the other employment. That's for us to worry about if we're calculating a state benefit based on multiple employment.
Yeah. So this question is the quarterly wage reporting submission for PFML different than the quarterly payroll submissions sent by payroll companies to the state? I don't know if that's a private plan or a general.
It's the PFML has its own wage reporting that's new to everybody, and it's going to be the same process whether it's public or state plan. But all wage reporting is being done through this new portal that we have, our new portal. But payroll companies, if they're doing it for an employer, it's gonna be the same process, whether or not the employer's in the public plan or the state plan, it's just gonna generate a $0 premium.
So this question is, would an employee be able to file claims with both employers?
Yeah, so if it all comes down to, you know, public, private. If they have two employers in the state plan, they can apply for leave from both, yes, and we would calculate their wage base based on that two employments. If they have multiple employers that are both in and out, yeah, they could apply for, depending on the medical condition or the situation, they can apply for leave across their employers. The state plan will calculate their benefit wage amount by the wages that are specifically within the state plan.
Okay.
And the private plan, it's up for them to calculate the wages that are specifically within, the private plan.
Okay.
So it all kind of works out to the same, it's just prorated in a way that it looks at the specific employment of public versus private.
Okay, but what about, what if that employee's with the employer with the private plan, do they have to go to that private plan employer, can they?
So
switch
an
to the state?
employee covered by a private plan, substitution cannot apply for state benefit.
Okay,
Yeah, if they have multiple employers and some are in the state plan, they can apply to the state plan for the employers that are subject to the state plan. But an employee who is covered under a private plan substitution cannot apply for a public plan claim because they're not covered, they're covered under the private plan.
okay. So this question is, all right, so if you cannot apply until April 1st, then how can you apply within the last 30 days of the quarter? So you don't have to have premiums taken out again?
I'm not sure what that's asking. So the last 30 days of the quarter would be, the first time that applies is June 1st to June 30th. If you apply in that window, the exemption is gonna be July 1st, if it's approved.
Okay.
Everyone's paying the first quarter, I'm not sure if that's what's asking.
Okay. For some reason, I'm saying the check was disabled. Okay. Sorry about that, if for some reason the chat was disabled.
It looks like there's still questions.
You still questions coming in, yeah, so yeah, now that I think about it, yeah, we create a separate Q&A specifically so that folks can channel it through one place, but must employees apply with all employers for each claim, or can they pick and choose which employer to apply for?
Yeah, no, it's up to the employee to apply for whatever claim they want. An employee cannot be compelled to apply for a paid family medical leave claim. That's a bit different from FMLA. It's the employee's choice if they want to apply for paid family medical leave. And there might be reasons why an employee wants to apply for one of their employers and not the other. I think that, you know, the best example of this is, let's say they have knee surgery, and they can work a sedentary job that they're working, but they can't work, you know, a heavy labor job. They might have reason to only apply for leave from their heavy labor job, while they can still work their sedentary job to make some of that income.
Right.
And that's, you know, beneficial, I think, to the employer as well, that, you know, the employer that's a sedentary job still gets to keep that labor. And the employee would have a prorated benefit based on, you know, the wage of the two.
This is a pretty good question. So on the attestation, the last bullet says all employees for an employer tax ID, but should that be changed to stipulate that is for Maine employees only? Not all employees, where an employer may have employees working in states outside of.
Yeah,
Maine.
that's a good call. We could probably make that adjustment.
Okay.
So thank you for that suggestion.
Luke, I think you hit on this just on the wage question. So if an employee has wages from two different employers, they both have private plans, or even one is in the private and one is in the public, can the claim be paid from both proportionally?
Yeah,
Okay.
I think I hit on that.
Yeah, you hit on that, okay. And then just to clarify, the surety of bond amount, what is the requirement again? For the surety bond?
Yeah, the surety bond is the employer would calculate the total amount of wages for the prior 4 quarters. So the 4 quarters preceding the application, and then would apply whatever their contribution rate is for the state plan. So 15 or more employees, it's 1% of those total wages. Fewer than 15 employees, it's 0.5% of total wages.
This
is an important one, right?
Yeah, I was gonna say, yeah, with the private plan, isn't it true that the employer cannot deduct more than the employee, then they would have deducted under the public plan.
Yes, and that is true. That's by statute. A private plan cannot withhold from an employee more than what the employee would have withheld from the state plan. So for example, our premium right now for the state is 1%, and that can be shared, depending on the company size with the employee up to 0.5% of wages. So if, for example, you have a private plan, and the premium amount is 1.2%, you cannot withhold 0.6% from your employees. The maximum amount that you could withhold for your employees to pay for, or to partially pay for that private plan is 0.5% of the wages, is whatever the employee would pay under the state plan. But you cannot withhold more than that, even if the private plan costs more than what the state plan would. So I'm glad somebody asked that. That's important clarification.
So we got about 20 minutes left, and we're just trying to make sure we hit all of the private plan questions. First, yes, the list is available. Actually, no, surety bond, no, we didn't get that. Is there a list of surety bond carriers?
There is not a list of surety bond carriers.
Okay.
However, if you go to the Maine Bureau of Insurance website, they do have a licensee search. And I believe you could search by type of carrier, and you should be able to get a list of licensed surety bond carriers in Maine.
So if the state plan cost increases in 2028, would this impact the total bond amount for those with an approved self-insured plan?
Yeah, I believe the bond amount is one year of the state premium, correct? Yeah. So if you have a bond locked in, for a 3-year, it wouldn't change that bond. But if you went and applied for a new bond, and the state premium was higher or lower, you would recalculate that bond amount based on the new state rate.
Correct.
Yeah.
These are two good questions. So the first one is, can an employer share the premium cost from a private fully funded plan with employees similar to the state plan?
As long as it's not more than the employee would be charged. So you can split it, up to 0.5% of the employee's wages. But the employee can never be charged more than what they would be charged under the state plan.
Okay. This question is, can you please elaborate on the acceptance of a trust as a private plan option? If employers join the trust, they would be submitting the same plan. Why wouldn't that be considered a fully insured plan in that specific instance? It wouldn't need to be approved and certified more than once.
And the trust question is one we might need to put out more guidance on, but our understanding of the law is that the employer needs to contract directly with the insurance carrier. Whereas a trust would be the one that would contract with the insurance carrier and then market those to the employers, if I get this right. But that being said, it's an issue we're actively looking into, and I think we could put out an FAQ specifically on trusts.
Okay, this is an interesting question. So if we had another company merge with our company and the FEIN number for the old company is still out there, are we at risk for a fine even though we're fully reporting one agency FEIN? I don't know if that's getting to private plans or just more of a general registration.
Yeah, it's hard to know, but I would say that if you're merging a company and you're taking on employees and you're on a private plan, like your private plan needs to cover those new employees if you want to maintain your private plan. You can never have employees under your FEIN who are uncovered. That's ground for potential revocation. Yeah.
And if I could.
Yeah.
I also think it's important, it's a difficult question to answer because it's very fact specific as to how that merger is occurring, whether it's a merger and acquisition with one surviving company, or whether or not it's a merger where the company that's being acquired is a subsidiary or an affiliate that still maintains its own FEIN.
Switching is self-insured kind of questions, but can a self-insured employer continue to collect contributions after approval for private plan, as they also need to build their funds similar to the state?
That's a good question. That's probably one we need to put an FAQ on. Do you have any immediate thoughts on that?
I think that certainly just as they can continue, they can't take out of employees more
Right, yeah.
than what they could otherwise take out, if they were participating in the state plan.
Yeah, my quick read of rule and statute is, I don't see why they couldn't. If it's after the exemption date, has started, and you're not taking more the employee, and there's a recognition that you can start benefits, sooner, or you can delay benefits up until May 1st. I'm not sure I see anything in rules or, statute that would prohibit that. But that's probably something I want to double check with our legal team and put out an FAQ on, similar to the trust question.
Okay. If we are approved for a self-insured plan, we are no longer collecting the 0.5% from employees, right?
Wait, sorry, say that one again?
Yeah, if we are approved for a self-insured plan, we are no longer collecting the 0.5% from employees, correct? I'm assuming the state plans.
So that's, I think, kind of related or
Yes.
dovetails into what I just said. So you can,
Okay.
after the exemption date, so the date that the private plan substitution approved isn't necessarily the exemption start date. That date could be, in the past, in my example, back to April 1st, could be in the future, in my example, up to July 1st. Once you're in the exemption approval date for the premiums, it's really on the employer to decide if they want to collect deductions from their employees to put towards a private plan, whether it's self-insured or fully insured, with the caveat that they can never withhold from the employee more than they would withhold from the state plan.
Just to clarify or to confirm, it was stated earlier, you cannot enter a benefit that begins later than 5/1/2026. So it seems the employer will be restricted from switching to a private plan after 5/1/26.
No, we're accepting private plan substitutions on a rolling basis for as long as the program exists, because people, and this happens in other states, employers opt in and out of the state plan all the time. And they'll make that decision, for their business as, reality changes in the community, or as price changes for private or state plan. So if you're, paying all along in the state plan and you decide, December 2026, that, it makes more sense for me now to have a private plan exemption, you could apply after that date, and your 3 years would start from the date it's, the exemption starts, and therefore, conversely, you could opt out, now in April, and decide in 3 years that, the state plan, I think I'm gonna come back into it. And you could, at the end of your 3-year period, just come back naturally to the state plan. So these private plans, substitutions are gonna be accepted on a rolling basis going forward. And the substitutions are good for 3 years, so there will absolutely be employers coming in and out of the private and public plan market on an ongoing basis.
I know this is one that we've been in conversations with municipalities, but many cities and school departments share an FEIN. Do these two entities need to work together in order to make a decision on the state versus private? And if private, both entities need to choose one private plan carrier to work with, as they can't file separate exemptions.
Yeah, exactly that. So it needs to be one plan per FEIN. So whatever your business organization is within that, it needs to be one decision. You cannot have separate plans within an FEIN, and you cannot have an election for a state versus private plan within an FEIN. So it needs to be one unified decision per FEIN unit. And I mean, along those lines, you can't obviously make individual decisions for individual employees. That's a question that came up at previous webinars, but you can't have certain employees within an FEIN, say a certain collective bargaining group. You can't make different decisions of private versus public for different collections of employees within an FEIN either. It has to be one unified decision for each FEIN, one plan, one in or out with the state or private.
Okay.
May I just wanted to clarify on the question about, can you apply for a private plan after May 1st, 2026? The rule does say for any substitution that's approved after May 1st, 2026, benefit coverage must commence on the first day of the first month following the approval of a substitution. So there is, the system does account for the fact that there may be plans that are approved after May 1st, 2026.
No, great clarity, thank you. Yeah, the one-time kind of delay that you can opt out now, but delay to choose to delay benefits up to May 1st. That's in recognition that, you know, the state plan is also starting around that time and people might need time to get things in order. Carriers might need to get processes in order. But after May 1st, 2026, that coverage should be the first day after it's approved. So it's making sure everybody's covered from that day forward in the state.
So just wanted to clarify for the private plans, whether it's fully or self-insured, the quarter reports are still an obligation.
Yes.
Okay. We still got about 11 minutes left, so still time to answer some questions. So we're just going through and making sure we hit all of them. Just more of a general question. Actually, no, this gets to private plan. So if a private plan is denied, can we resubmit an amended application?
If a private plan is denied, then the employer will have 15 business days to appeal the denial of that decision. And if upon appeal, the denial is upheld, then the employer could go ahead and file a new application for a private plan substitution.
I would just make sure, like, if you're getting denied for a reason, like it's not a certified plan, I wouldn't waste your money or your time just submitting the same not certified plan. I'd probably, if you switch to finding a certified plan and submit a new application, that's absolutely allowable. But if the underlying issue hasn't changed, I'm not sure. You certainly have the right, but
Yes, correct. You would want to bring the plan application into compliance so that we could properly approve it.
Thanks. Just more of a general question. Is there somewhere that we can be contacted if folks have general questions?
yeah, please call the helpline. We are training our call center in all things private plan as well. So our general PFML call line for all issues around wage reporting, poorly used private plan application is on our website, but it's 207-621-5024. Again, 207-621-5024 is our general assistance helpline. People are there and they're answering calls without any wait time.
Okay. So this question is, if an employee previously worked for an employer with a private plan, but now works for an employer on the public plan and they take paid family medical leave, is their benefit amount lower than if they worked for employers with the public plan?
No, and so this is, I think, partially why, or this is why we've designed the system the way it has, is because the law requires that these benefits are portable. So that's why wage reporting is still required, even if you have a private plan substitution approved, is that the wage base, we're still collecting the wage based data, regardless of whether or not somebody's in the private plan or public plan, so that these benefits are portable for any Maine worker, you know, switching jobs, which obviously people do all the time. Their benefit amount in the state plan will always be the same because we're collecting the wage data regardless of exemption status. So that is, you know, by design to be in compliance with the statute, that these are portable benefits where the employee can move across the state and expect the same level of coverage or comparable level of coverage and the same benefit amount.
This is a good, and we have about 8 minutes left. So what if an employer who works for an employer that has a private plan leaves this employer and goes to another employer who uses the public plan and files a claim with the new employer? Is the previous employer liable for any public plan funding?
No, it's where you work at the time of claim, that's where your coverage is. But no, that's built into the system that it goes in line with the answer I just gave.
Right.
That we're still collecting wage base, so that these benefits are portable. Okay. And conversely, like it's a requirement in the private plan process that their wage base is calculated to be fair to what they're actually making at the time of a private plan claim. So it does go both ways. That by statute, these benefits are designed to be portable so that somebody can move throughout the state and have similar coverage and similar benefit amounts.
Okay. And also too, I know there was an early question a while back. is, will the PowerPoint and the recording be available online? And the answer is yes. We'll post those shortly, after the webinar. If the private plan, this next question, if the private plan costs less than the state plan, can the employer charge the employee the full 0.5%, even if that is more than 50% of the total cost for the cost of the plan?
That's a good question. That's something I'd want to run by the legal team
Okay.
too.
Okay.
Yeah.
So if the employer is approved for a self-insured private plan and uses a third-party administrator, then changes the third-party administrator sometime during the 3 years, do we need to apply again, even if we're keeping our plan? And if so, what would be the cost to reapply? So they have TPAs and for whatever reason they switch.
If it's self-insured,
Yeah, the self-insured, yep.
that's a good question too. I mean, that's at least a substantial material change that would need to be pre-approved.
Yes,
Is my initial thought, yeah.
yes, I would think that that's a material change that would need to be pre-approved by the department. But I'm not sure that it would require a whole new application process.
Yeah.
Can privately funded, not insured plans withhold the 0.5%?
I think that's the self-insurance question.
Yeah.
So yes, you can still withhold up to 5% for self-insurance,
Okay.
0.5%.
10%, okay. All right, so we'll just go through. So we have about 5 minutes left. Okay, so this is a clarification question. It was stated earlier that we need to return withholdings if withheld during the approval process. But now are you saying that we can continue withholding even if we're approved for a private plan?
Yeah, so this is where I'd read the FAQs because it's confusing, but it depends on during the period of deliberation. So if you're withholding for the state plan, and you're applying for a private plan substitution, and the substitution approval makes it so your exemption date goes back in the past, the deductions that are made towards the state plan need to be paid back to the employee because they were deductions made for the state plan. And then from that point forward, the employer can deduct for the private plan, but deductions that are made for the state plan need to be returned to the employee by rule. And that is in rules, that is in FAQs, I think a little bit better described. But that is the structuring of the regulations. And the other thing to remember with private plans is that you're setting a policy start date with fully insured products in the future. You're not gonna be submitting, I would think, or I wouldn't recommend, submitting a policy that's already started. You're gonna be submitting the consideration for a policy start date that's usually, the month after or potentially up to May 1st, 2026. So you haven't started paying premiums on the fully insured product yet. And like Judy said, after May 1st, 2026, the coverage date will be the first day of the first day of the month after the substitution is approved, which is also the day you would start paying premiums for the private plan. So there's no reason to be withholding for the private plan premiums anyways, because you're not paying towards it yet.
So more of a general question, will the draft quarterly report be available for review soon, or if available, where's that located with the instructions?
I believe it's in the portal now. If not, I know we just looked at adding a file for the draft. There's also step-by-step guides for wage reporting, which I think includes the draft wage reports. So that would be on our website at maine.gov/paid leave under the tab that says Maine Paid Leave Contributions Portal. It has the 2 webinars that we demoed the contribution portal there, as well as step-by-step guides on how to register, but also how to file individual wage reports and bulk wage reports. So I would point people to that resource, and I'm pretty sure it includes captures of the wage report.
Yeah, actually, can you scroll back up? There's a good question. So from this individual, I submitted this during the presentation, but have not heard an answer yet. But if teachers who are not exempt until September 1st of 2026, are their wages excluded from the calculations of the 1% for the surety bond amount?
That's a good question too. So that's the CBA question, because the CBAs are exempt until they expire for the first time, and they're not even included on your wage reporting. So I think the short answer to that, if I'm conceptualizing it right, is it's the bond amount of the people you have on your payroll who are subject to the law at the time.
Yes, wages paid
Yeah.
during the 4 most recent
Yeah.
quarters.
So you would be calculating it based essentially on who is subject to the law in those 4 most recent quarters. And people who are covered on a CBA that existed on 10/25/23 that has not expired yet are not subject to the law yet, so they would not be included until that CBA expires for the first time, at which point they would be included as of that date.
All right, we have about 1 minute left, so we're gonna try to answer as many questions as we can. But if an employee works for multiple employers and ends up paying more than the maximum, assuming premiums, is the amount, how much, I guess, will they get a refund?
They would have to reach out to us, the department, they would be eligible for a
Okay.
refund. If they hit the social security wage cap from
Right.
multiple employers, the employee is eligible for a refund, yes, they would contact us.
Okay, this is gonna be the last one I hit on, but how will claims run outs work? So I hope I got this right. When employers switch between state and private plan or the other way around, do existing claims transfer plans, or does the plan that commenced during the claim at the time of the leave retain liability?
It's the latter, so it's who you applied to the original claim for prevails.
Yep.
Even if you switch jobs in that time.
Okay. All right, so we are at time, and so thank you all for, chiming in and answering, or asking all the questions, that we got today, but if, folks can, again, we will put the private plan recording online as well as the PowerPoint. But if folks can go to www.maine.gov/paid leave, that is where you will find this webinar and the content under the Employer Resources tab. And also that's where all of the things that Luke mentioned today, such as the FAQs, are available. So with that, I wish everyone a great afternoon and take care.